Hey, good afternoon, and thank you everyone for joining us. We're going to give members of the media just a second to get attached to the Zoom, but we'll begin momentarily. And I'd like to ask everybody that joined from the media to please keep your audio on mute. We'll have a chance for you to unmute and ask questions at the end of the event. So with that, I'm Chris Trumbauer with the County Executive's Office. We're going to get started, and we're going to turn it over to County Executive Pittmand as soon as he's back at the podium, which is right now. So, Executive.
All right, thank you, Chris. I don't think there's any secret about why we're here today. The COVID-19 surge has gotten to a point where the rate of spread is unacceptable to, I think, virtually everybody in Anne Arundel County. We know that we have to flatten the curve as we did before, and we're here to announce our strategy to do just that in Anne Arundel County. But before I talk about the actions that we're going to take in the county, I think it's essential that people understand the context from the public health perspective and from our hospitals in where we stand. And so I'm first going to turn it over to Dr. Nilesh Kalyanaraman, our Anne Arundel County Health Officer, who's then going to introduce representatives from our Anne Arundel Medical Center and Baltimore Washington Medical Center, our two fantastic hospitals that treat the public here in our county. And then we're going to hear from Dr. Ellie Klein from Johns Hopkins, who puts out the hospitalization impact reports that I read every week when they come out, that make projections about where we may be heading in terms of hospitalization numbers. So, Nilesh.
Thank you, County Executive Pittmand, and thank you for your leadership during the pandemic, and particularly for your focus on those whose health and finances are most precarious. The pandemic is taking a toll on all of us, on our physical health, our mental well-being, our personal finances, our social well-being. It's 1 year now since this pandemic first appeared, and in that time, it has completely changed our daily lives. While it's been a long road, there is cause for hope. Today, the FDA will make a decision as to whether to approve the first vaccine for COVID-19. I have reviewed the data, and they are impressive for all groups, including Blacks, Hispanics, and those over 65. This will be a game changer, and when the vaccine becomes available for me, I will take it. For all of us to take advantage of the vaccine, though, we have to keep people from getting COVID. When I was here last month, our case rate was at 23. Our hospitalizations were increasing. We talked about the need for action and for individuals to double down on basic COVID safety, wearing a mask, watching your distance, washing hands, and avoiding. While those measures helped, the virus is in our community and spreading faster than we as individuals can handle. Our case rate today is at 47 and climbing. We've had 3 days in the past week with over 300 cases. Our hospitalizations in the county are growing. Today, the state reached a new high in hospitalizations during the pandemic, 1,720 people. Our hospitals will continue to care for everyone that comes through their doors, but we know that we are putting stress on their system, and that stress is increasing each day. The pace of deaths is growing with more than 1 per day in our county. We're up to 297 official deaths plus an additional 12 who were not tested. There are more and more people with long-term consequences of getting COVID. The disparities we have been working hard on are roaring back with Blacks, Hispanics, and now Asians disproportionately affected by this pandemic with higher positivity rates than average. Low-income workers continue to be disproportionately hit by this virus. Contact tracing and case management is a model program that we stood up from day one and has contact traced every one of the nearly 19,000 people who have had COVID in our county. It was constructed to be effective up to a case rate of 25 to 30 and staffed to handle up to a case rate of 35. We have progressed past its capacity to effectively stop the spread of the virus. We will continue providing case management for COVID positive people, but starting next week, we will only be reaching out to a limited number of contacts focusing on those who are at higher risk. As the pandemic progresses, we must adapt our tools to meet the situation. we've progressed to a point where further systemic action is required to reverse our current path. We must act to prevent flooding our hospitals with COVID patients so that they can take care of the full range of medical needs they see every day. We need to make a final push over the next few months to keep people healthy enough to get that vaccine. We pushed the curve once, we can and will do it again. And so at this point, I'd like to introduce Dr. Neil Babakar, the Chief Medical Officer at Baltimore Washington Medical Center, who will discuss the situation at his hospital.
So thank you, Nilesh, and thank you, County Executive Pittmand, for inviting me today and for all that you and your team have done. I'd like to first start by thanking the residents in Anne Arundel County for the overwhelming amount of support and sacrifice you have made.
Andrew, listen, I can't do this right now.
Once again, I'd like to start by thanking the residents in Anne Arundel County for the overwhelming amount of support and sacrifice you have made over these last 9 months. As we enter this new phase, I know we are all tired, but it is important that we do not let our guard down. The science is clear. Wearing a mask and avoiding crowds saves lives. These actions could save the life of a friend, a parent, or a grandparent. At Baltimore Washington Medical Center, we are experiencing increased hospitalizations comparable to what we are seeing throughout the state of Maryland. With the wider community spread of COVID this fall, our hospital is busier now, both with COVID and non-COVID patients, than we have been over the past several months and busier than we were during the spring. Our staff continue to rise to the unprecedented challenges presented by the COVID pandemic and are answering the call to care for our neighbors and our community. During this holiday season, we know that the greatest risk of transmission of COVID is in family gatherings and indoor gatherings. This will make the holidays especially challenging, and the best advice is to avoid travel and avoid gathering during the holidays. This will keep you and your family safe while ensuring that hospitals across the state don't become overwhelmed. And as Nilesh said, there is light on the horizon as several COVID-19 vaccine candidates move closer to approval. And while we wait for that approval, we must remain vigilant. We must continue to adhere to the safety precautions we know to work, wearing a mask, washing your hands, and watching your distance. And finally, I encourage everyone to continue to seek care when you need it. Do not delay. Our hospital and our outpatient practices are open, safe, and prepared to care for you. We still have a very small window of opportunity to turn this around, but working together, Anne Arundel County has proven we can flatten the curve and save lives, and I believe it's time we do it again. Thank you.
Thank you, Dr. Babakar. Next, I'd like to introduce Dr. Mitch Schwartz, the president of Luminous Health Clinical Enterprise, to discuss the situation at Anne Arundel Medical Center.
Thanks, Nilesh, and thank you so much, County Executive Pittmand, for inviting me to speak. I support what Dr. Babakar mentioned, and we too are seeing a rise in the volume of COVID patients, a steady rise, an unrelenting rise. And unlike the springtime, the volume of patients coming through our emergency room is what we had experienced prior to the COVID pandemic. So both volumes of patients are in our hospital now in substantial numbers. We are pulling every lever that we can to expand capacity and recruit staff to care for those patients, and we have been successful so far. The main problem, as Nilesh mentioned, is that the rate of rise continues unabated, and action needs to be taken to mitigate that and to flatten the curve. We want to remind the community that we are safe, ready, and open for all illness, not to be fearful of coming to the hospital or to visit your doctor for whatever ails you. And please do not avoid those opportunities for care. We want you to know that we are safe, ready, and open. Don't delay care. We're here to care for you. As we enter into the holiday season, let's do our parts to care for our families, our friends, and loved ones. Let's wear a mask, wash our hands, and watch your distance. But really try your best to avoid large social gatherings. The risk is highest in those social gatherings, And we want you to have not only a happy, but a healthy holiday season. So thank you, and stay safe.
Thank you, Mitch. Next, I'd like to introduce Dr. Ellie Klein, an associate professor at Johns Hopkins Medicine, to talk about what to expect from the spread of the virus over the coming months and how to address that.
Thank you, Nilesh. Appreciate the chance to come to you all. And again, my thanks to County Executive Pittmand for the leadership that he's shown at the county level and at the state level. This is a disease that spreads like the flu and cold. It's a respiratory virus, and it spreads in the winter more effectively than it does in the summer. So everything that we've been doing in terms of actions to limit spread are in the winter and the summer, in the summer and in the fall, are not as effective. And that leads to more cases. Seeing a lot more cases, people start to, not only does it spread more effectively, people start to spend more time indoors. And so that leads to more cases. So we've been doing a lot of modeling to try to estimate how this spread is going to happen. And we've been predicting for quite a while that there was going to be a surge in the winter, and that surge is now happening. And the projections in terms of the number of hospital beds, if we don't do things to contain the spread, is going to be beyond the capacity of the state. And that will lead to degraded care for many people and to unnecessary mortality and morbidity. This is a disease that spreads indoors. And so I would suggest, as everyone has said before, that wearing a mask indoors is paramount. But again, avoiding places where you might take off a mask, avoiding indoor gatherings is a priority, because testing, as has been shown in many places, is not enough to contain the spread. The tests are not 100% effective. So just getting a negative test does not mean that everybody is able to go and visit your family. So unfortunately, the projections are that this is going to get worse, just as the flu typically gets worse as we move into the end of December and into January. But as Nilesh has said, and others have said, there is a light at the end of the tunnel. The vaccine is coming, and as well as spring is coming. And those two things combined will start to allow us to get back to normalcy later in the year. But we really need to get through the next couple months in order to keep the hospitalizations at a level that will allow us to care for everyone effectively.
Thank you, Dr. Klein. And now we'll turn it back over to County Executive Pittmand.
Yeah, thank you, all of you, for the work that you're doing in your hospitals, and Dr. Klein for the work that you're doing on behalf of all of us in public health, and especially Dr. Kalyanaraman, whose team at the health department has been working, doing really working miracles, from contact tracing to the testing that they're doing and the planning for the vaccinations, and also advising me, and to be honest, pushing me and explaining to me and my team that there is no way to handle the kinds of projections in our hospitals that we're looking at if we don't push down the numbers. So the governor has told us that we have 8,000 staffed beds in the state of Maryland that can take patients, and that our hospital census is somewhere a little over 7,000, at least as of last week. And that when we get to 8,000, including our COVID patients, that the strategy then is to make room for more. And making room for more patients means delaying healthcare procedures in the hospitals that would normally be taking place. And I know that all of you have people in your families, I do in mine as well, who potentially could need to go to the hospital for some sort of procedure, or have something actually scheduled that, according to the standards might not be urgent, but that doing so could eventually potentially save a life. So we're not just talking here about saving lives from COVID. We're talking about saving lives from people who might not otherwise get the health care that they should get. So the numbers that are projected by Dr. Klein in his statewide projections, if nothing changes, if our actions continue as they have, put us in the range of 10,000 COVID patients needing hospitalization during this surge. You can do the math and see with 8,000 beds, that doesn't leave room for anybody but COVID patients. So that's what we have to prevent. And I don't want to sugarcoat that. Unlike the spring, we don't have the ability to recruit as many people, healthcare workers from outside the area, because the whole country is experiencing the same surge. Whereas back in the spring, it had started in the Northeast and the West Coast. So we could recruit from elsewhere. And back in the spring, the surge capacity was created, and it cost public health a lot to do that, to end the procedures that hospitals would normally do. So we don't want to be in that position. So as you know, I'm not the only one in the region that is taking action. We have notified the governor's office of what I'm about to tell you, so that they're aware. I have reason to believe that the governor will be supportive. The governor was very clear recently that local jurisdictions should do what they believe is necessary to push down the numbers. So let me talk to you about the things that are really difficult to announce, because we have done everything that we could in recent months to prevent this from happening. And in the past, as the governor made the tough decisions for us in the beginning by closing things down, and then the decisions were about how quickly to reopen. And as you know, Anne Arundel County did not go into phase 3, and we moved more slowly than the state. Most of Central Maryland tracked about where we were in terms of openings. But now we find ourselves going the opposite direction and having to go back to some of the restrictions that we had earlier in the pandemic. So I want to note that the restrictions, the actions that we're announcing today are for 4 weeks. If at the end of 4 weeks, it turns out that our hospitals, and these are the metrics that I'm looking at the most closely, is hospital capacity. If our hospitals are doing fine and the hospitalization increases did not happen as projected, that will tell us something, and it's likely that we will then be back on the track to reopening. If we're in worse shape than we are now, then these will have to continue. But we'll have data at the end of 4 weeks. We'll know in a couple of weeks whether or not these actions have helped. I also want to note that these are going to take effect not immediately. We're going to wait until Wednesday at 5 o'clock, which allows our restaurants that I'll be getting to be able to use some of the food that they've already purchased, and it will allow us to hear input from stakeholders. We've notified many stakeholders already of these actions to get their inputs and their thoughts, done some surveys as well, but we will be hearing more, and there may be some minor adjustments as we go. So let me start with restaurants and bars. And the reason I'm starting there is that our contact tracing and the contact tracing all across the world has shown that these are facilities where people can't wear masks and where the virus is being spread at higher rates than retail or any other business activities, short of social gatherings that are not controlled. So I also want to note that the CDC said just recently that people over 65 or people that have health conditions that might make COVID worse for them if they get it should not enter any public place where people are not masked. In other words, they should not be entering for their own safety, restaurants and bars. And so I want to protect those people. I think we all want to protect those people. So the action that we're taking is moving from the 25% capacity in bars and restaurants that we're under right now to takeout only. And as we do this, I want to encourage people to think about this the way they did early in the pandemic, that we need to do takeout, that we're going to actually implement a social media campaign and call it Takeout Anne Arundel, and encourage people to get their meals in their restaurants. You can even pick up your drinks, wonderful mixed drinks in restaurants. And there were restaurants that were doing pretty well financially under the takeout scenario when they really marketed well. So we are going to help market that as well. We know that this is going to have an impact on the people who work in these restaurants and the restaurants themselves. So we have a package of assistance for them. We have put out $5 million in direct grants to restaurants, and we're about to start putting out another $5 million. The first was from our county CARES money. The second is from the state CARES money. In addition to that, we're going to be adding $1 million to an initiative called Feed Anne Arundel, and we're going to be hearing from Monica Alvarado about that in a minute, that actually pays restaurants to prepare food and meals that then go out into our food distribution centers so that they are provided to families who need them the most. So it keeps folks working in the restaurant as opposed to just writing checks. We were also notified by restaurants that the delivery services like DoorDash and others are not charging consistent rates, and they're in fact gouging in some cases these restaurants with rates as high as 30% for delivery. We are going to be bringing a bill to the Anne Arundel County Council to restrict the rates that they can charge our restaurant owners. And then we're going to be waiving the licensing fees that our restaurants pay this year. And as I said before, we're going to be initiating Takeout Anne Arundel to encourage people to do takeout. Retail will be moving to 25% fire code capacity. I do not believe that this is going to have a major impact on sales. And the reason for that is that most of the fire code capacity in our stores is never reached. It's during the holiday season that it's likely to get crowded in our retail establishments, and they know how to manage that because they've been here before. So for customers, it may mean waiting outside until there's capacity, but I strongly encourage people to still shop local. Some of our retail establishments are also doing internet sales and curbside pickup. So please support our local businesses in this time. Fitness centers, they will remain open, but capacity will, like others, be at 25%. But one of the issues that we got the most complaints about, that our health department got the most complaints about, was people not wearing masks in fitness centers and being too close together. So there's a loophole in state law that says that if you're having trouble breathing, you don't need to wear a mask. And when you're exercising, often that creates that trouble. So people will take off their masks. We're going to require masks in our fitness centers. And if people can't exercise without a mask, then they should exercise outside or at home. Also, we're going to suspend classes at fitness centers where groups of people together are exercising in a small space. Another difficult one is our casino. Live Casino has been a wonderful community partner. They're a wonderful employer. They were closed for a time and it was very difficult. They've implemented safety protocols in the casino that have impressed all of us. However, they're going to be moving from 50% back to 25% capacity. And because of the restaurant closures, there will be no food service in the casino, but they will be able to continue operating. And we've notified them, and very difficult conversation. But we believe that if all of these things work, that they'll be back in operation before too long. Personal service establishments, hairstylists and salons will remain open at 25%. They know how to do this. There may be a little bit more waiting in the car than there was. Some of them have continued that practice, and we thank them. Religious facilities will continue to operate. We surveyed a group of our faith leaders who I had been meeting with in the past about what a 25% capacity restriction would mean in terms of their ability to be able to practice their faith with their congregations. And for many, they said that was not going to be a problem. We did find that some were operating at a 1/3 capacity. So we're going to go with that. And the capacity indoors at religious facilities will be limited to 1/3. We're also making it possible, a special exception on outdoor gatherings, so that outdoor religious gatherings can operate with as many as 250 people. during the holiday season. And there's no limit on obviously drive-through, drive-up worshiping. Fellowship addiction recovery will be limited at 25% capacity or 50, whichever is less. We want these operations to continue, these groups to continue, of course, with social distancing and masks. Social club facilities, and these would be Elks, American Legion, VFW, clubs and organizations like that that have facilities, are allowed to stay open at 25% capacity, but no food or beverage service. Organized sports that already were suspended at our rec and parks facilities and in Anne Arundel County Public Schools, that will be extended to all sports facilities. And then theaters and live entertainment venues will be closed for this 4-week period. Bingo halls, bowling alleys, pool halls, roller rinks, indoor ice rinks, all closed. Adult entertainment also closed. So I want to remind you that this executive order takes effect next Wednesday at 5 p.m. It will be in effect for 4 weeks. And we understand that this is going to be a burden for our residents. And none of us wanted to make these decisions. I understand that Baltimore City and Prince George's County, and I believe others in Central Maryland that border us are taking very similar actions. And I believe that the governor will support these actions because we all want to push these numbers down. So on behalf of the residents of Anne Arundel County, I'm sorry to bring you this kind of news, but I'm heartened that so many of us believe that this is what we need to do, that we need to push these numbers down. We need to protect our healthcare system. And at the end of the day, we're going to look back. At the end of the pandemic, we're going to look back on this time and we're going to ask ourselves whether there was more that we could have done to save lives. And I don't want to be in a position of wishing that we had done more. So because restaurants are probably the organizations most impacted by this, and their employees are people who are low wage in most cases. And I've got to say that low wage workers in this county and in this country have been the ones who've been hurt economically by this pandemic more than any other. I've asked Monica Alvarado to join us. Monica started an organization called Feed Anne Arundel as an extension of ACT, Anne Arundel Connecting Together, a community organization. She runs a restaurant called Bread and Butter Kitchen and has done amazing work getting restaurants engaged in preparing meals for people who need them. So Monica, I guess I have not, did I say, I believe I did. We're doing $1 million, Monica. You said you could handle it and we're going to deliver. So we're looking forward to working with you on that.
Thank you so much, County Executive Pittman, and to your entire administration for the support that you've provided to Feed Anne Arundel. We understand in the restaurant industry that these decisions have to be made. They're painful for all of us, but we are very grateful for the opportunity to continue to work with restaurants throughout the county. As Mr. Pittman indicated, we use money that we've raised through grants from the county as well as through private donations to pay restaurants directly so that they can continue to keep their employees working, place orders with their vendors, and farmers, watermen, delivery drivers, your food delivery drivers. We are committed to making sure that the full supply chain continues to work, and we want our restaurants to survive so that they can then thrive in the near future. So thank you again. I would just say to all the restaurants in the county, we still need more restaurants to join. There are opportunities throughout December and with this additional funding, January through June, that we will be working very hard to keep restaurants providing food to those in our community in most need. So please reach out to me at feedannearundel@gmail.com if you'd like to participate. And I really encourage all restaurants to reach out. We would love to make sure that we're all in a position where our employees are working and able to take care of their families as well. So thank you.
And I would just add that for people who are in economic distress as a result of these restrictions, previous restrictions, the changes in the marketplace as a result of this pandemic, that the county has a warm line, 410-222 food. It began as a food warm line, and now it's connecting people to all of the services that we're providing, the eviction prevention work, the food assistance work, the $500 debit cards that we're making available. There's a whole, we've worked to build a safety net. It's never enough, and we absolutely need more help from the state and federal, particularly the federal government, and we're cautiously optimistic that more of that will be coming.
Thank you, County Executive. We now have a few minutes for some questions from members of the media, so you can unmute yourself and ask a question, or you can type it in the chat.
Hi, this is Lily Price from the Capital Gazette. Executive Pittman, do you know how long these restrictions will be in place?
4 weeks. We're putting them in place for 4 weeks. If there's a need to continue them, we'll have to reassess that at the end of the 4 weeks.
If restaurants and bars in particular are unsafe, why don't you tell residents to avoid them altogether even after the 4 weeks? Is it because you don't have the funds to support these businesses if they were to remain closed?
We have discouraged people from dining in recently. I think the health department has put out notifications of that, while encouraging people to pick up their meals and eat elsewhere. When the weather was good, we were encouraging people to do the outdoor dining. Right now, outdoor dining tends to be tents with sides on them and heaters blowing. So that's no longer much different from indoor dining. So no, we have not been encouraging people to go dine in as these numbers have gotten worse.
And why 4 weeks exactly? What came to that decision?
Some jurisdictions have done 2 weeks. We don't believe 2 weeks is enough to see the impact. If we get to the end of 4 weeks and these projections, particularly hospitalization projections, don't come true, then we'll all breathe a sigh of relief. We'll go back to where we were, and our numbers, by then will have been pushed down, and we'll be able to get back on the reopening track. But I, of course, can't make promises. We're gonna look at the same factors that we look at now in terms of everything, economic as well as health, but primarily health and saving lives. So, but it was important to have an end date in mind, at which point we have to have this conversation all over again.
Other questions? Okay, thank you, County Executive, and thank you to our panel.
Thanks, everybody.